According to the National Autistic Society, there has been a 50% increase in people waiting for an autism assessment compared to last year. This follows after NHS waiting lists have reached record highs. Our reporter Aaron Stokes joins me in the studio. Aaron, how many people are now on the waiting list?
Well, according to data that was published by the NHS yesterday, there is currently 157,809 people on the waiting list. However, out of this, there's 134,315 who have been waiting more than the 13 weeks or 3 months has been recommended by the National Institute for Health and Care Excellence. On top of this, there's an additional 9,239 cases alone in September. However, out of these, there has been 7,003 that have been successfully closed in the month.
And what needs to be done to help lower the wait list?
Well, this comes on the back of the NHS facing record waiting list numbers. This year alone, there is currently 7.8 million people, according to the British Medical Association, on the waiting list for treatment, and this equates to about 6.5 million individual cases. So the wait time as well for these people on this waiting list has also increased. It is now, the median wait time currently is nearly 15 weeks, and this is nearly double the pre-COVID levels. And according to Mel Merritt, who's the head policy and for campaigns at the National Autistic Society, has said it is appalling that a waiting list for autism assessments in England has risen by 50% in just 1 year. In 2021, the government promised in the autism strategy that it would make significant progress in reducing diagnosis waiting times, but the figures released today show that the complete opposite is happening. Without urgent long-term funding for diagnosis services, waiting lists will keep increasing. The government and the health secretary must invest in what autistic people need and keep the promise it made. Anything less is unacceptable. And it's not only the National Autistic Society that are calling for change. The British Medical Institution are also calling for an additional £7 billion worth of funding on top of the £10 billion that was announced in 2021 by the Chancellor, now Prime Minister, Rishi Sunak. And they also plan to increase NHS capacity, so those that are waiting over 40 weeks don't have to then rely on going to a private hospital for their treatment.
Thank you, Aaron.